you for such a Thank you for such a nice introduction, Chris, and I'm really happy to be here with this group today. I think this is such an important and timely topic for all of us. So I'm looking forward, hopefully, to having some exchange with the people out there in the webinar as well during the course of this, since I suspect some of you may be travel medicine practitioners as well. And feel free to pop that in the chat if you are, so we'll get a sense of what the background of the audience is. So today, oops, sorry, just make sure my slides advance. So today I would like to review the current landscape of travel and share with you a little bit of data from our GTEN network. I'll discuss why there are more risk factors for people who are traveling home to visit friends and relatives. And what I'll really be focusing on is how do we prepare our VFR travelers for returning home, particularly with regards to protecting them from malaria. And I would like to introduce you to our Heading Home Healthy website and suite of tools that are designed to make that job easier for everybody. So I'll just start out by making the point that I think we all know from our lived experience that international travel has really just been going exponentially in terms of its increase over the last couple of decades. And this is data on international tourist arrivals from the World Tourism Organization from 2018, which showed the pace of increasing international travel to that date, where you see that in the context of overall increasing travel, there's also been increasing travel specifically to areas of Asia and Africa and destinations where we're more concerned about malaria to begin with. So of course, that was before COVID, and I'll talk with you a little bit about what we've seen since COVID. But we know that traveling internationally has risks associated with it. There's risks of acquiring a disease that is unique or more common in the destination country. There's risk of importing this disease to the US, as we certainly have experienced during the COVID pandemic. We know that certain travelers are at higher risk, and they're the ones we worry about the most. People who have compromised immune systems, pregnant women, people at the extremes of age, and then also particularly people who are visiting their friends and relatives. And a pre-travel health encounter, the work that we do before people leave the country, aims to decrease these risks, and it does serve an important public health purpose as well. So what is it that's special about VFR travelers, as we call them, and who are they? VFR travelers, visiting friends and relatives, the definition has adjusted over the years, but really we're talking about people who are first or second generation immigrants, typically who are returning home to their country of origin, often low middle income countries, to visit their friends and relatives. And we well know that these travelers have a higher incidence of travel-related infectious diseases, malaria, typhoid, tuberculosis, hepatitis A, sexually transmitted diseases. And there's a lot of reasons for this. A few of them being, one, a lack of awareness that a trip home is associated with risk. It's understandable that one would think that a simple trip home to see your family shouldn't entail a concern for yourself. There certainly are financial and cultural barriers to the idea of having a medical visit or preparing medically for a trip overseas. We know that VFR travelers have behaviors that are different than people who are traveling for other purposes once they arrive in the destination country. These are behaviors that will adjust or affect the risk of acquiring disease while there. There also is a commonly held belief that people are immune to the diseases of their home country, and this is one that we commonly hear with regard to malaria, and certainly requires some thoughtful conversation to engage with that belief, which is widely, I find, held. And for all of these reasons, VFR travelers in general are less likely to pursue any kind of pre-travel healthcare. I just wanted to share with you a little bit of data that supports the notion of that. This is a study that we did here in Boston at Logan International Airport, where we approached and surveyed about 1,200 people who were departing from our airport. And notably, really only about half of people traveling to destination countries that you would generally consider to have a concern had sought any type of health advice prior to departure. So this is a common theme that many people fail to seek any pre-travel advice. And I'll direct you to the table where we looked at all respondents as opposed to people who are traveling for visiting friends and relatives. And there are some important differences here. Most importantly, I'll direct you to the fact that the internet is an important source of information for all of these travelers. And notably, most of them weren't going to the CDC website. But importantly, particularly for VFR travelers, it really is the primary care practitioner who is the point of contact if there is health information sought. So this really raises the notion that having an engaged and informed population of primary care providers is important in order to appropriately prepare people to travel, particularly those who are VFR travelers. So I'd like to take a minute and just share with you what our experience within GTEN has been like during the COVID era, what we're seeing. I think we all know that travel has declined, precipitously during the COVID pandemic, and appropriately so, with over 70% decline in travel to most parts of the world from the U.S. So there is a decline. We were interested actually in understanding who is traveling now that the kind of COVID era has come into play, and we have begun to see people for pre-travel health consultations again. So I'm going to share with you a little bit of data from our GTEN network, and I just wanted to first introduce you to the idea of what the network is. So we are a consortium of about 25 clinical sites across the US, all of which provide pre-travel health care in some capacity. Many are medical clinics, but we also have pharmacies, health centers, and primary care practices involved in the network as well. And we're broadly geographically spread across the US. So looking at the data that we've collected from our network, I'm just going to show you here a table where we've looked at more than 16,000 people traveling in the year before COVID. So between January 1st of 2019 and December 31st of 2019, and 1,500 people who traveled after COVID. So between April 1st, 2020 and March 15th, 2021. So first of all, it's worth pointing out that the number of pre-travel health consultations we had in our GTEN network declined precipitously during this time period. But there also has been a shift in the type of people who we've been seeing in our network. So first of all, with regard to age, you can see that we've had a transition to younger travelers. Looking at the duration of travel, we have seen a shift towards people traveling for longer periods of time, more than half of people going for over 30 days. We've seen a predominance now of travel to Africa, and that is different from the pre-pandemic period. And notably, with regards to the subject today, we've seen that VFR travelers now comprise the majority of people being seen in our network, whereas before that was not the case. Consistent with the destination shift towards Africa, we see now that 80% of people seen at our travel clinics are going to a destination that's endemic for yellow fever. And I do believe that the yellow fever vaccine requirements have been driving some of our clinic visits. So the bottom line here is that there has been a dramatic alteration in the type of people who are traveling during the COVID era, and certainly a shift towards more VFR travelers, particularly VFR travelers to Africa. We also took a look at what was going on with the vaccines that were being administered to people in association with their pre-travel health consult. And of course, it's worth noting that many of these visits during the COVID era have been virtual. And so I think the nature of the visit has changed from what it was before. But I want to point out to you that I think there have been some missed opportunities for vaccinating departing travelers that we're seeing from our data. So if you look across the bottom, these are the vaccines that we looked at: MMR, hepatitis A, influenza, typhoid, Japanese encephalitis, and yellow fever. And in blue, you can see the percentage of departing travelers who were vaccinated for these diseases in the pre-COVID era on the left and in the COVID era on the right. And so you can see kind of across the board, there's been a drop in the number of people actually receiving vaccines like MMR and hepatitis A and flu actually at their visits, whereas there has been an increase in the people receiving yellow fever vaccine. So I think a lot of this is attributable to the nature of the types of visits that we're able to do now, but it is an important cautionary note that there have been, even with people seeking pre-travel health care, some potentially missed opportunities for vaccination before departure. So the point of today's talk is to focus a bit on malaria and preventing malaria in the VFR traveler. And so I think it's worth taking a look at the recent MMWR publication on surveillance of imported malaria in the United States, and pointing out that there has been a steady rise in imported cases of malaria in the US that's been going on for the last couple of decades. And this data published in 2021 reflects travelers through 2017. So in 2017, there were well over 2,100 imported cases of malaria in the United States, and it was representative of the ongoing trend of increasing imported cases. A pattern that has been commonly seen and has continued to be seen in the data from 2017 is that Africa is the most common geographic region where malaria is acquired in travelers. So as you can see from the table here, over 90% of the US residents acquired malaria in Africa. And here you can see the purpose of travel for the people in whom it was known who acquired malaria. And again, importantly, visiting friends and relatives is the most common purpose of travel for people who represent imported cases of malaria. So this is the population that we are concerned about. So why did these people get malaria? Well, the data from the CDC surveillance show clearly that, the reason is that these individuals either did not take or did not adhere to a recommended chemoprophylaxis regimen. And the reasons for non-adherence that are cited most commonly are prematurely stopping the medication or forgetting to take the medication or experiencing a side effect from the medication. Of course, this is aside from just not being prescribed the medication in the first place. So clearly our mandate as providers and people who interact with departing travelers, particularly VFR travelers, is to be sure that they are taking one of these medicines with them on their trip. We have at our disposal medicines that are safe and generally well tolerated that can prevent imported cases of malaria in the US. So we need to be getting these medications out to people as they're departing. I think, for this audience, these are medicines that I suspect are familiar, but, I'll just take a minute and kind of run through what our toolkit of medications are. Nowadays, the by far most popular choice is Malarone, which is a daily medication that has pretty rare side effects and is available in a generic form. So probably by far the number one choice. Mefloquine, a weekly medication, now has a black box warning and is really not being as commonly used because of its neuropsychiatric side effects. Chloroquine has been not available for some periods of time and is also only useful for specific destination countries where the drug still works. Doxycycline has been a go-to medication for long-term travelers and is an excellent choice for those who can tolerate it. It can't be used in young children. because of the tooth discoloration. And it does have some side effects. It can cause pill esophagitis, photosensitivity, and vaginal yeast infections in women, but it is certainly a workhorse of malaria chemoprophylaxis. And then there's primaquine and tafenoquine, a newer related drug, which frankly are rarely used for prophylaxis, largely because of the necessity to check G6PD enzyme levels before prescribing them. So they're in the armamentarium as well. And then I always like to just be sure that whenever we're thinking about malaria chemoprophylaxis, that we remember that along with that goes important education about mosquito avoidance. People need to be informed about the times of day when they're at greatest risk for mosquito bites, how to use bed nets and screens, how to prevent mosquito bites through the use of insect repellents and permethrin. So these go hand in hand with the chemoprophylaxis strategies as well, and have the added benefit of preventing other mosquito-borne diseases as well. I'd like to remind people that the EPA regulates insect repellents. I think there is a really huge array of products out there, and I find it useful to be able to refer people to the EPA website about skin applied repellents for those who want to dive deeper into the options. We spend a lot of time focusing on DEET, but there are other EPA approved insect repellents that particularly oil of lemon eucalyptus, people who prefer not to use a chemical agent can use. But it's important to be sure that people are selecting an appropriate product that is effective at repelling insects. And I am glad to see that the EPA is working on developing some strategies for labeling products that are a little more consumer friendly. So what are the barriers for pre-travel care of VFR travelers? What do we have to think about when we know this is a population that we should be targeting for preventing malaria? Well, I've mentioned before some of the financial and cultural barriers. I think the knowledge gaps are what we are often drawn to as a way to address, because we can educate people, we can have conversations with people. And also, I think trust is another important component of this. I think we've learned during the COVID pandemic how marginalized communities, immigrant communities have struggled with issues of mistrust with the medical system. And I think that there is an overlap between the lessons that we've learned this past year and the techniques and strategies and approaches we need to have when we approach VFR communities about malaria chemoprophylaxis as well. So I'd like to just say a couple of words about that topic. I think that this is an area I've spent many hours contemplating over the last year. And I think that we are drawn to a desire to address knowledge gaps first, because that is our natural inclination as doctors. But I think there's a cautionary tale in the approach of simply trying to provide people with information. And I just want to point to this actual randomized trial that was published in the pediatric literature regarding vaccine promotion. In this trial, parents were randomized to receive information about the MMR vaccine in the goal of increasing vaccine uptake for their children. The information that was provided is what I think many doctors would assume to be an excellent approach for bridging a knowledge gap. Information about the lack of association between the MMR vaccine and autism, textual information about the dangers of the diseases, images of children with the disease, and narrative stories about the disease. And it's worth pointing out that none of these interventions had any effect on parental uptake of the MMR vaccine. So I think it points to the limitations of simply bridging knowledge gaps as the approach to health outreach to marginalized communities. I think the other thing that I just will point out as we've reflected on the COVID year is trust and the role of trust between the healthcare system and communities, and how do we build trust in order to be trustworthy providers of health information. So I think that that's a component that we all have to be considering as well as we think about VFR travelers. And I just wanted to share with you what I feel like is an excellent body of work developed by the American Association of Medical Colleges around the principles of trustworthiness for healthcare providers. And I refer you to it here. I think these are principles that we can keep in mind in our own engagement with communities and individuals. And a lot of it has to do with listening and being present through difficult times. So I just want to point to trust as an important element of bridging the gap. So I would now like to turn to telling you a little bit about a program that we've developed in Global TravEpiNet called Heading Home Healthy, which has the aim of trying to provide tools and resources. And now as I think about it, building trust with communities about the issues of preparing for international travel, particularly for VFR travelers. So the program is supported by MGH. We've had a wonderful working relationship with the New York City Department of Health and Mental Hygiene on the program and the CDC. And I'm showing you here our website location. Our goal is to help travelers stay healthy when they return home. And also because we've seen that primary care providers are really so essential to offering pre-travel health preparation, that we wanted to offer them a quick go-to place to find out what they need to do with their traveler in the office. A lot of what we heard in our conversations with primary care physicians was that the travel question kind of was what people tended to bring up as everybody's hand was on the doorknob heading out the door. And it's not something that they have dedicated time to focus on during the visit. And so the aim of this program is to provide quick reference materials and handouts and everything you need to provide a pre-travel health encounter without being somebody who does it all the time. So here I'm showing you our website. This is the home for the program materials. This is what it looked like before COVID. And this is what it looks like now, where we really have adjusted our approach to have focus on getting people materials that are reliable about COVID. But I'd like to walk you through a little bit about the website and the tools that we have available so that you can be aware of them for your own practice or use. And so maybe what I will do is try to go actually over to the website here. And Chris, let me know if I'm getting this wrong.
We can see it.
You can see it? Okay, great. So here's our website currently. And across the top, we have a bar, a navigation bar that shows you the different target groups for who we're trying to reach. We're trying to reach the traveler. We're also trying to reach the clinician. And I just want to also share with you that one of the real areas of work we've had is developing some video materials that are useful for places like a provider's office, but also that tell the story of what happens when you get malaria, when you're going home to visit, when you send your 4-year-old daughter home to visit your parents. So this is the story of a woman who we were fortunate to find through our collaborators in New York, who was willing to sit down and tell the story of what happened to her. And so these are, I think, narratives and ways to access people on this topic. So I'd like to also just kind of tell you a little bit about the tools that we've developed that are for the traveler and for the clinician to help people get ready to travel. So the first tool we have is called Trip. This is actually also available on a mobile device and is really designed as a short checklist to get people to think about the fact that they need to see their doctor before they go away on their trip. It's available in a lot of different languages, as you can see across the top. And at this point, we've had tens of thousands of people using the tool. And so I'm just going to walk you through what it does. It really just asks for some simple information about age. We like to know the zip code so we can keep track of who's using it. And then we ask, what country are you going to? So I'll just pick Bangladesh. And what this does is we update this regularly. It's consistent with what is the current CDC guidance, and it provides people with just a checklist of what they need to do before their trip, what they need to do during their trip, and after their trip, and then links to additional sources of information. So our goal here is to just get people thinking about the fact that travel has some health risks associated with it. We have a similar.
And Regina, that goes out in their language. So if you put it over, if you hover at the top,
for sure.
right?
So we have it available in 14 languages. This is Spanish and French. We have Bengali, Haitian Creole, Uganda. So we've translated it into many of the languages that our travelers are commonly speaking.
And then you can print that out for your patient in their language, right?
Correct.
Okay,
Yep.
Great, thanks.
Now, this was responding to the desire to get people thinking about the fact that traveling is a health risk and that you need to talk to your doctor before you travel. We also wanted to respond to the fact that primary care doctors and other people in their clinic are having to make decisions quickly and figure out what they need to do for their traveler in their office. So for that, we have developed the PrEP tool. And this is similarly a tool that is updated in real time. We really envision this as a interactive yellow book. So let me just walk you through, walk you through how that works. So we do collect a little bit of information at the beginning because we want to understand who's using the tool. And again, we do know that tens of thousands of providers have used the tool to date. We collect a little bit of information about the traveler, and this is really what we need to know in order to give you the precise feedback of what this traveler needs. And so this information is used in order to provide you kind of a customized output of what this traveler needs for their trip. So let's say we have a 35-year-old female, and I'm going to pick going to Bangladesh. We're interested in knowing a few things about them that tailor our recommendations. So one of them is whether the person is a VFR. And then I'll just point out to you here, these are common conditions that affect the type of prophylaxis you might provide or what medication or what vaccines might be indicated. So I'll just select for this person that she's pregnant. And so what you get here is a set of customized clinical guidance, really the pre-travel encounter in a package for you. And we have some warnings and other things baked in at this point, particularly related to COVID. But what we tell you is what vaccines this traveler should get. And if there's more information needed, you can link to external sites at the CDC. And we talk to you about, what information you want to provide the person on insect avoidance. And then we give you some very specific recommendations about malaria prophylaxis. We don't just tell you all of the medicines that are possible, but we tell you what we would recommend. So this is a pregnant woman, so the choices are more limited, and that's why you're just getting, mefloquine as your choice here. But this is a customized set of outputs. And I just want to point out that we also have developed in a number of languages, handouts that can be given to patients at the time of the visit. And this is what we use in our travel clinic here at MGH. So here's the handout. It's a one-page printable handout, very similar to the trip tool that I showed you. It's a checklist of what you're going to need to do during your trip. So, if I see somebody myself in clinic, I check off for them the malaria prophylaxis I've given them. I tell them what we've talked about with insects and animals and other things, and I can make some notes at the bottom. So this is available on the website. And as I mentioned, it is, I don't want to close out the whole thing here. It is available in multiple languages. So we have it in Arabic, Bengali, Portuguese, Chinese, etc. So that, I think, is kind of a quick tour of what the Heading Home Healthy program includes. And you know, I hope that you will be able to share it with other primary care, you know, particularly primary care providers and you know, those who might benefit. I want to mention that we have a newsletter that is designed both for travelers and for providers, and we send out a monthly update, and you can sign up for that here. And we also have a number of promotional materials and handouts that can be printed directly from the website as well. Handouts on malaria, malaria prevention, mosquito-borne illnesses, etc. And then I would like to encourage you to take a look at some of the video material that's available here as well, because these are, you know, 90-second videos, things that we hope people can take the short amount of time to watch, but provide some very essential education about preparing for travel. So Chris, is there anything else I should show about the website?
No, I think you covered everything on the website. I will just say, because I'm a fan of this website, you know, once you start using it, it's really easy because you just put in Heading Home Healthy and it comes up, and you can use it while you're with patients, you can use it while you're teaching. And I was saying to Regina, sometimes when I have someone coming from an area of the world with a fever and I want to know, oh, is malaria in that area, I just throw it into Heading Home Healthy. It's just such a great website. I can't say enough great things, and we use the patient education forum here in our clinic. There is a question though, Regina, and I'm not sure that you're going to be able to answer it for New York. So it'd be interesting, and it would be interesting for people to chime in. And so the question is cost of anti-malarials. Can you comment on the cost of anti-malarials and also insurance coverage? And I know with insurance coverage, that's going to be difficult for you in Boston, but comments on that, Regina.
Sure. Well, I mean, I think that, as I mentioned, financial barriers are one of the issues. And I think this is a theme that we commonly have heard across time about chemoprophylaxis for travelers. So I think it's so variable between communities that it's hard to make any kind of blanket statements about anything, because I think that, you know, in New York, there may be programs that are available to you that are not available somewhere else. But of course, like if you want people to take medications to prevent disease, they have to be affordable and available and inexpensive. And that is an ongoing concern. Well, I mean, the approach we took early on with this issue was actually to look at our GTEN data and to evaluate the cost effectiveness of malaria prevention. And we published a paper a couple of years ago now on this topic. And the bottom line is it's highly cost effective. So, you know, giving somebody, particularly for travelers to West Africa, the highest risk area, our healthcare system saves money by prescribing malaria chemoprophylaxis. So we do need to figure out a way to not only make it accessible, but affordable to the populations that need it the most. You know, the good news is these are generic medicines for the most part, and so they should be available at an affordable price. I'm not sure I can give you a good answer beyond that, but it's a very important component of the picture.
For my Bronx friends on the call, and I see there's a fair amount of them, we put together a list of travel clinics. I'm going to send it out to everybody so they can look at it. It's got times of the day, what insurance you accept, etc. So you should look at it. If you're not on it, you can obviously ask me, I'll put you on it. And then Department of Health has that on their website. And then the The next thing we're going to try to do in the Bronx is look for pharmacies that are willing to actually give better pricing. And so we're trying to look in areas where there are large numbers of, we have mostly West Africans here in the Bronx. If people are interested in working in other boroughs with me, I see my NYU friend on there. So people can reach out to me and we can start a travel list through all the boroughs. And that, you know, if we can get that done, I'd be thrilled to do that. And I think it's really hard when you're taking care of patients. If you get some pharmacies that will actually accept insurance for a month, that's what we do. That's kind of helpful. So if you know those pharmacies, that will be our next thing. And hopefully we can help out the providers on the call.
So I think I just have here some screenshots of our various video materials, and I just want to highlight the traveler story about malaria. We have videos on the general kind of preparation and safety during travel, but we also have some specifically on food and waterborne illness and on measles. And so I think these are great short clips that people can watch while you're in the waiting room, to be honest with you. And these are also available in different languages. We've done a lot of outreach in New York and Boston, particularly around the program. And I'm just sharing with you some photos. Here's Paul Kelly, who's our collaborator in New York City. And so these are nice, you know, a toolkit of materials to have available. So maybe what I'll do is have a case and we can discuss a little bit about some issues related to malaria prophylaxis in a VFR traveler. And I certainly will ask Chris a few questions along the way too. So, you know, I think a common type of visitor a traveler that we're seeing now, a 35-year-old woman and her 4-year-old daughter going together to Ghana to visit family, planning to stay for a prolonged period of time. They're healthy and departing. Well, what I'm seeing lately is departing, you know, next week. And I guess I'll say that I'll just, you know, state the obvious, which is that the point of this webinar was to talk about malaria, but of course, as travel practitioners, we have to have COVID at the front of our minds. And I know we're all thinking about how do we have conversations with people about being sure that they are protected from that as well. And you know, making sure people are vaccinated before they do trips like this. So what's your experience been like on that front, Chris? I'm interested what you're seeing.
In terms of travel, we're seeing people come right now. We're seeing people, and I'd be interested if people could chime in. I'm getting mostly Africans right now who are leaving, like you said, in the next couple of days for long trips. And I'm going to be interested for you to talk about how you deal with the mefloquine issue, but we'll see what other people say. Is that other people's experience? I know that there's a couple of you that run travel clinics on I know who you are here. So I don't know if that's others' experience, but that's been our experience. The uptick in the Africans going back home has been huge in New York City. And we are now doing some, as you know, we're doing some outreach in some mosques, and we're being told that we're already too late, that people are already leaving. Although I do think August will be a big month.
Yeah, I think that is very consistent with, as I showed you, the data from our own networks. And you know, I think one element is that people are often traveling with children, and so it is a complicated situation for the families when the children are unvaccinated. So even when you have a vaccinated parent, there's often a complexity of the whole family unit. So I think we're all seeing the same type of situation. But I'm going to focus on malaria chemoprophylaxis since that's our subject for today. So I don't know if I can do a poll, but I just wonder what the kind of thoughts of the group might be on the choice of prophylaxis for this particular family unit of a mother and a child.
So for the mom or the kid, which one?
Yeah, the mom and the kid, the mom or the kid. And
okay, so could everybody chime in? I know there's a pediatrician on this call, Nat Littman. So chime in. What would you give mom? Or what would you recommend? Any I'm looking at the Q&A and you're a quiet group. You're going to make me pick on you. You're going to make me
It's
answer.
okay. I can't see the chat.
Louise Tatum, tafenoquine, if G6PD is okay, the new kid on the block, that's great. Okay, so we have a tafenoquine.
Okay,
And then someone's gonna give mom Malarone, and then take her to call the pediatrician, or I'll call the pediatrician. So the pediatrician on the call, what would we do? So Nat Littman, my pediatrician, mefloquine for both, much less expensive than Malarone for 3 months. Okay.
Yeah. Oh, that's great. Thank you for a couple of thoughts on it. Well, you know, I think these are difficult situations, right? And so I am sharing with you my conclusion on this. Which
I need to interrupt you. Yep. Lynn Chen has spoken. Can you just go back up to the case for a second? Lynn, 35-year-old and 4-year-old going to Ghana. No other medical problems, Lynn. Okay, now go back down.
We'll assume nobody's pregnant.
Nobody's pregnant. Okay.
Well, it's interesting because I think that what we hear is that the practice varies, and that we are influenced by a number of different things about the people who are traveling, as well as the costs. And so I'll share with you, my thoughts, which is I would want to give the mom doxycycline, and I would probably give the child Malarone. But I do think that mefloquine it's been very hard to have that removed from our armamentarium. And I think many people, for travelers like this, still want to consider it. We have ourselves kind of a protocol for consenting people to take mefloquine, and that's understandable in the light of the black box warning. And I haven't given anybody tafenoquine myself, so I'm very intrigued that there's some people out there using it. I think it requires some real advanced planning that is often not available in circumstances like this, but it's intriguing. And I don't know about cost on that one. How do we think about malaria chemoprophylaxis? Well, it's an individualized.
For a second, Regina?
Go ahead.
Could you just talk a little bit about the black box warning? Because I heard Ed speak about this on a previous talk, and just for all of us, because I'm old school like that, and I used a lot of mefloquine in my day, and then I have patients that have been on it and are comfortable with it. So can you comment on that?
I have it actually coming up. Yeah. So, how do you think about malaria chemoprophylaxis? Well, the bottom line is it's an individualized decision that requires some thoughtful consideration by a clinician and the traveler themselves. And that's because the risk of malaria differs, in the destination countries. It differs within the destination country. We know that travelers to West Africa really are the highest risk group based on the data that I showed you before from the CDC surveillance. So, I always take away the message that, those are the people I want to twist their arms. If they have concerns, those are the people I really want to be seeing and giving prophylaxis to. And it's a risk assessment that gives you a different output for different trips and different people. It can range from doing nothing to just doing mosquito avoidance to doing mosquito avoidance and chemoprophylaxis. So these are just some maps to show us where the countries in the world with malaria are, and obviously they are many across Central and South America, Africa, and Asia. And so how do we think about what medicine to choose? Well, we have to think about the side effects, and that is an important concern for people who are taking medicines, voluntarily to prevent a disease. And unfortunately, the fact of the matter is that none of the medicines are without side effects. And so it's kind of important to be sure that we've gone through the side effects with an individual, and that they at least have an anticipation and understanding of what they could be, because that is one of the factors that leads people to stop taking their medication. So here I'm showing you the black box warning for mefloquine, which was issued a couple of years ago now. And I think, there's a history and multiple factors that were, went into this decision in order to issue the warning. I think the warning it's quite clear once you have a black box warning that it's hard not to adjust your practice in response to it, especially when it describes what are very concerning adverse effects. So I think that we were faced with having to adjust our practice based on this. That being said, I mean, personally, there are still circumstances when I will prescribe somebody mefloquine after very careful conversation, but at this point, it becomes your second line choice. I have to have thought about other things first and had reasons to dismiss them. And I think, children are one particular population where once a week medication has a particular advantage. And so I think that that's worth acknowledging. The other thing when you prescribe somebody chemoprophylaxis is just to be important to understand where they're going to get their prescription filled, make sure they're planning to get it filled here in the United States. Sometimes there's a misunderstanding that this is a prescription they're going to take and get filled on their trip. And for, that's not the case, number one, but also you really would prefer medicines from US pharmacies to be what people are taking. So you want to be sure the prescription is filled here in the US. You want to be sure they have enough of their medication to get them through their entire trip. So a lot of times the trip, as we've seen, is long duration. So you have to be sure that the pharmacy knows to dispense the right amount for the entire trip and that the person is sure to get that. The other factor that's at play as you choose a chemoprophylactic agent is also resistance. And it's always worth pointing out these border areas of Burma, Thailand, Cambodia, where historically and presently malaria resistance has been a concern. These are the areas where mefloquine resistance exists. And so obviously this is not Africa, but we still need to be aware that changing resistance patterns of the parasite itself are a consideration as well. I'll point out another kind of strategy that is worth considering in people like the traveler that we've shown here is having a reliable supply of treatment for malaria. So particularly for people who may be not willing or not interested, or you're not sure if they're going to take your malaria prophylaxis, it is also a consideration to prescribe a reliable supply of a malaria treatment. So treatment doses of Malarone or Coartem to take with them from here to have to be sure that there's access to treatment if needed. I think I already kind of went through with you the importance of partnering the chemoprophylaxis with education about mosquito avoidance. I'll share with you, I've been working on my own strategies for how to engage people in this area. And I think that, the psychology tells us that the way you get people interested in a topic is to kind of unsettle their own understanding of what they know. And so we had an interesting talk at the travel medicine meeting about how you can kind of maybe use some approaches of psychology and conversations with people, getting them to question their own beliefs. And so I've kind of moved more towards starting out with just asking people what they are planning to do to avoid mosquitoes. And I've gotten some interesting questions and answers. And so instead of just giving information, trying to engage with people's understandings. The advantage of mosquito avoidance, of course, is that we're also preventing other diseases that are endemic in the same areas. And I think important among these are dengue, as you can see from the maps here, many of the same countries. I want to leave a little time for questions, but it's always important to emphasize the importance of fever in the returning traveler when you're talking about malaria. And I just want to remind the audience that whenever somebody returns from travel with fever, particularly within the first month of travel, it's really important to consider and reconsider and consider again the possibility that this is malaria and be sure that appropriate testing has been performed. And then lastly, who really needs to see a travel medicine specialist before they go on a trip. You know, travel medicine specialists are always happy to see everybody, but there are some people who have particularly complicated itineraries, pregnant women, immunocompromised people that are especially appropriate for a visit focused really, excuse me, only on the trip. Excuse me. These are a few key resources I'll just point out. And maybe I'll stop there and see if anybody has any questions or comments. Chris?
I have some comments, but there was one comment in there, Juan Robles, that Malarone is weight-based in children, and so a small child of 35 kilogram will need to take 3 tablets a day. What would you recommend in that situation?
I think that's the circumstance where you have to understand the likelihood of that child being able to take that medicine. And that's where you end up with, I think, naflequin still being on the table at times, because that's an individual decision about the capacity of a family to get that medicine into the child. And it is hard with the pediatric tablets and the number that has to be given.
Right. And any other questions? Any questions about preparing your pregnant traveler? No. I'm looking to see if there are. I will say I see a combination here. Oops, there's a question from Marguerite Mayer. Marguerite Mayer's from Monty says, managed Medicaid plans in New York City usually only give 1 month of medication, and that's right. They do. That's right, Marguerite.
So these are big problems. Like these are big problems which our health system needs to work on solving, because I mean, we've already shown that it's cost effective. Like I would say that it's probably worthwhile, using that information as physicians to advocate for what we need, which is that it's pretty much a no-brainer for things that save the health system money, that we should be able to provide them. And so I think that those are important problems. I mean, we know from the CDC, MMWR published surveillance that the people who return with malaria often stop taking the even the ones who do take it, they stop taking it while they're traveling. So one reason for that would be not having enough medication. Right. So we need a system fix for that problem, but it is a legitimate concern. Yeah.
I do think, and I see there's a combination of ID and primary care on this. And I do think that primary care is at the forefront. And Paul Kelly's group did do a study a number of years ago asking people in the Bronx Lebanon waiting room, are you traveling home or do you plan? And I think 90% of West Africans said they were planning to travel home, 50% within the year. So for primary care, and they're already crushed with so many other responsibilities, but if we could also work this in, I think it's the same advocacy, because it is part of our, the migrant's life is to go home and visit their friends and family. So it's part of their well-being. And so I think us ID people need to be working with our primary care to get that partnership going. Right now we're working on that at Lincoln. I see my Lincoln friends on the phone, but I think it's really important. And I think helping.
Yeah, I think that is a great point. And I would encourage, some of the materials that we have here are natural entrees into those kinds of conversations. And we probably should be assuming that people are planning to travel, no different in terms of screening, do you smoke? Are you planning to travel? Like it lends itself really quite well to the types of screening questions that you might have before you see anybody. It's better to be proactive. Yeah.
Right. What I do, just for everybody on here, since I'm not a primary traveler, is I give my card and I say, when you're planning on traveling again, at least call me at least 3 weeks before and I'll make room for you, so that they know that I've acknowledged it. And it goes back to what Regina said, which Regina, I love that thing that you said about trust, right? And I think that was really impactful. And it goes back to that idea of acknowledging that this is an important part of your life and the trust between you and your patients. So, Any other comments here before we call it? Okay, so Gina said that we can pass out the slides. There's a lot of good information in them. So she's got a lot of nice websites, et cetera, listed in there. So my big plug is in August, I don't have the date in front of me, we'll be talking about our Tesonate, and we're planning in the fall a half day on travel. Thank you, Anne-Marie. 8/5 is our Tesonate. So we'll be talking about our Tesonate in August 5th, and then we're talking about a half day on travel, which will be a partnership with ISTM. And Lynn is Lynn Chen, who was on this. I don't know if she's still on it, was the past president. If you're interested getting involved with the community, I feel like travel encompasses tropical medicine, travel, immunology, vaccines, primary care, ID. So it's a great place to find fellow colleagues. So if you want to find out about that society, I can connect you with people. We're all, any of the people who've given talks would be happy to talk to you. So with that, there's a question from Lynn Chen, past president of ISTM. Okay, if I can find it in the chat. There's two chats here. Lynn. So regarding costs, my patients have given feedback that the AAA card gives drug discounts and good, prescription cards. Anyone have experience with AAA?
The American Automobile Association?
Yeah. That's what I think she's saying, and she's not going back in there. So yeah.
Wow.
Yeah, so that's pretty cool. I don't know if anyone else is saying it. If I have information, Lynn, if you have information, if we find that, we'll send it out to the group. Wow, Lynn's just popped on. How did she get on as Lynn? You want to unmute yourself, Lynn? Come on, Lynn. And she's coming on, Lynn. Lynn?
Am I supposed to talk?
Somehow you beamed yourself in as a panelist. I don't know how. So
I don't know who put me there. So thanks. Yes, some very reliable patients have told me that they've used AAA card for drug discounts. I have not tried, but I think for patients who are wondering about their insurance coverage and cost of the anti-malarials, that's one of the suggestions we give. And then the other one is this card that somehow gets sent to our clinic, and it's good RX, and apparently you can follow the directions on the card, and it gives you a comparison of drug costs. And some travelers have said that's helped them also. And I think it's a pharmacy sponsored card.
Okay, so we'll try to find out about that, and Anne-Marie and I almost try to send it out to you, out to the people that were on the call. So thanks a lot, Lynn, and thanks for joining us. We appreciate it. So
thanks for the session.
Yeah, Regina, this is wonderful. Thank you so much, and thanks for everybody who stayed on and hung in there at the end of the night. You know, you're going home now, so thank you. Thanks, Regina. Thanks.
My pleasure. Thanks for your work.
Yeah. Thanks so much. Thanks for yours too. It's amazing. All right. Speak to everyone soon. Bye-bye.
Bye-bye.